All right, so tumors. Okay, so talking about defects and diseases of the nervous system. We are here now at tumors. So a brain tumor is a growth within the brain, places pressure on the brain, and starts to impede brain function. So impede means to like hinder or to stop from. Okay, to impede progress would be to stop progress or to make it difficult. So in this, looks like maybe an MRI. You can see there's a brain tumor starting to overtake the healthy brain cells in the brain, and yeah, that's gonna affect the person for sure. So you guys, we learned about cancerous growths and tumors before, and there can be tumors anywhere in your body, including your brain. Blood flow disruption. Okay, a stroke. You've probably all heard of strokes before, know what a stroke is. And this is when blood flow to the brain is interrupted. This starves the brain for oxygen and neurons start to die off. So when blood flow is interrupted, there's different kinds of blood flow interruption. So the different types of strokes we'll learn about in a minute, but it's either it inhibits blood flow through a clot, or there's a break in the blood vessels in the brain and it releases too much blood flow, and that saturates and kills off the brain cells around that bleed. So blood flow is interrupted. That's why if you hold your breath or you don't breathe for a few minutes, like if you go unconscious or you're not breathing, that's why CPR is really important, to keep the blood flowing throughout your body. And we might talk a little bit more about CPR, but do you guys know what CPR stands for? Yeah, cardio is the first word. Pulmonary, yeah. Is that resuscitation? I think it is, yeah. So cardiopulmonary resuscitation. So cardio is heart, pulmonary is lungs. When you compress the rib cage, you're squishing the heart and you're pushing blood out of the heart, and the releasing kind of keeps the blood kind of flowing through your heart into your lungs. And you give breaths as well to kind of inflate the lungs with air so that your body can still function, because if your brain, and this is especially why you do it, if your brain is starved from oxygen for more than a few minutes, then there's permanent damage, like bad stuff going on. Okay? All right, nervous system treatments. Treating the diseases of the nervous system is really varied, because the type of damage that could or has been done can be quite varied. So treatments, it's a very complex system, so it varies a lot. Trauma, let's talk about trauma. The main treatment for head injuries is to stop the injury from getting worse and to give it time to heal. So we can't, at this point, fix physical damage to the brain. It's very complex, and there's brain surgery, there's little things we can do, but to actually piece together the brain, it's too complex. So there's definitely things we can do. We can cut out tumors very carefully. We can reattach, nerves or bypass things, but to fix the brain and all of its functions is very complicated. So when your brain gets injured, like through concussion, which we talked about yesterday, it is quite serious, and it right now it just needs time to recover. So as your body generates blood flow and just as your body allows itself to heal, that's kind of the best thing we can do for things like concussions. Question? Yeah.
Just a comment on that is that sometimes also you can also have post-concussive syndrome. So basically it's like you have the continued effects, but the concussion originally is kind of.
Infection. Okay, infections are treated quickly with the person being hospitalized and given intravenous antibiotics. So antibiotics fight infection. Sometimes life support is needed while they fight the infection, as parts of their nervous system may shut down. So if someone is in an induced coma, that would be sort of like they're basically chemically put unconscious, so their brain and their nervous system and those important organs don't have to work so hard to keep their body going. Machines can come in and help while the body heals. So so there might be machines hooked up to a person who has a serious brain injury to allow time for the brain to heal, so the machines can kind of take over the function of the brain temporarily. Yeah. All right, degeneration. We talked a little bit about this. Most degenerative diseases that cause dementia are incurable. Some, however, are vitamin or other supplement deficiencies. There are some medications that can slow dementia for a time, but generally the treatments are to help the person manage symptoms and avoid depression. So, yeah, degenerative diseases, especially of the brain, like dementia, when you start to lose function, your cells start to die, parts of your brain start to lose function and memory and skills and things. And in some cases, supplements and that kind of things can help restore or at least stave off some of the effects. But most degenerative diseases are incurable. Now, there's lots of gains being made, and you can keep your eye open for medical advancements. They're always doing research. They're always trying new things. And so there's discoveries that happen all the time. And maybe you guys will be doctors and nurses and researchers someday that you'll find a cure for dementia. Or maybe you'll be able to reverse these kind of processes in the future. That'd be great. But for now, they're degenerative, and they can't be fixed necessarily. Structural defects. Okay, people with birth defects often are treated with surgery where possible. So some structural defects, that is how the brain's actually physically put together, some of that can be fixed with surgery. And I think this is a pretty generic picture. I'm not sure what they're working on. It could be a brain. I don't really know. But yeah, being a neurosurgeon, a brain surgeon, is pretty delicate work. Yeah, you have your hand up? Can you move what? Yeah, you can come up closer. You bet. Yeah. Tumors. Okay, let's talk a little bit more about tumors. We know what they are. What about treatment for tumors? Tumor treatment depends largely on the kind of tumor and where it is. Most are operated on and removed. Some are treated with chemotherapy and other medicines, and obviously some with radiation too. But chemotherapy is chemical therapy. So basically, there's harsh chemicals, like poisonous chemicals, that are put into your body to attack certain cells, and it would be the cells that would be the cancerous cells that you're going after. But the trouble with chemotherapy is it also attacks healthy cells as well. It's fairly indiscriminate, and that's why people that are on chemotherapy, like this little kid here, often you lose your hair. Your hair is pretty delicate, and chemotherapy affects hair loss. Affects weight, affects energy levels, muscle mass, and a little bit. And so chemotherapy, although it does a fairly good job of attacking cancer cells, it also unfortunately sometimes attacks healthy cells too and makes you pretty sick. So when someone's going through cancer and they say, "Wow, the chemotherapy sessions have been really bad," they're suffering almost as much from the help that they're getting as from the cancer. And so that's unfortunate sometimes, but it depends on the type of tumor. Brain tumor, they'll try and go in and take as much of it out. Some chemotherapy and radiation obviously would affect other parts of your brain. So I don't know, but I haven't been through it myself. Don't know much about it, but I don't think they do much radiation for brain tumors. It's mostly surgical and chemotherapy. But so if we move on to stroke, blood flow disruption, there are two major kinds of strokes I mentioned before. The main kind can be treated and largely reversed if within 3.5 hours of the stroke, the patient receives an IV of TPA, a drug that dissolves the blockage and improves blood flow to the brain. So if it's a clot that is blocking blood from flowing through vessels and to important parts of the brain, if that's what's happening, and you would know the signs of a stroke, which we'll probably go over that in a little more detail. But if someone is experiencing a stroke, this happens really relatively quickly within minutes that you start to notice some changes in function. And so if it's a clot and you get to the hospital right away, you can get this intravenous of drug that basically dissolves that clot and the blood can flow and hopefully not much damage has happened. If it's an aneurysm, if the stroke is due to an aneurysm, that means the vessel has burst open and there's been a brain bleed, and so with excess blood in saturating the brain cells surrounding the bleed can obviously affect and kill some cells there, so that's not good either. And that's a little tougher to fix. If it's a clot, you get the clot buster medicine, and everything kind of improves, and hopefully there's not a lot of permanent damage. But if it's an aneurysm, might be a little bit, there might be longer lasting effects. So, okay, any questions on any of this so far? That was the last kind of half of the nervous system lesson. Any questions?